Okay, good day. I'm Dr. Ebony Lambito Aliza Divesa, and now we will be discussing about conduct disorder. So, conduct disorder is actually with regards to children, but when they reach adulthood, there is higher incidence that they can develop antisocial personality disorder. But now we will focus on conduct disorder. So, what are the criteria for conduct disorder? So, I will enumerate the criteria and explain this. Okay, so it is. Okay, so we have actually 15 criteria. So at least 3 of this manifested by a child can actually in 12 months can be considered conduct disorder. So what are these criteria? So they are often bullies. So if you have seen my video about bullying, there are criteria who are the bullies. So one of these criteria, those who have conduct disorder are actually bullies. They threaten or intimidate others, okay? They threaten them to hurt them physically, verbally, or usually threaten them with regards to school performance. They initiate or they start physical fights. So usually they enter frats, or if they are joining sports, they usually start the fight with other children, with other people, okay? So they can also use weapons. So they can bring a knife or any sharp objects in school or in areas that can actually cause physical harm to others, okay, like broken bottle, knife, gun, and bat, and others, okay. Some other criteria are they are physically cruel to people, so they hurt other people, okay, physically most of the time, physically, or they hurt other animals, okay. They usually use pellet guns to shoot some animals they see, okay. They are cruel to animals. Others actually kill animals. So other than that, they stole things that do not belong to them. So they are stolen while confronting a victim, like mugging, purse snatching, extortion, armed robbery, okay. They can do that, okay. So other criteria, forced someone into sexual activity. So usually they have perverted minds and they do sexual activities without consent. So they can actually be condemned, or they can actually be imprisoned due to rape, okay. So and other legal matters. There are also other criteria for conduct disorders, such as they deliberately engage in fire setting. So sila yung nagsisimula nung sunog, okay? With the intention of causing serious damage. So may intention talaga to harm. Okay, they deliberately destroyed others property, like other than fire setting, okay? So gusto nang sirain yung property ng iba. So those children who have conduct disorder also has broken into someone else's house, building, or car. So nagtitrespassing talaga sila. Okay, these are actually criminal acts, no? They often lies to obtain goods or favors, or to avoid obligations. So the example is cons, no? They lie. They often lie. Okay, they also stolen items of non-trivial value without confronting a victim. Like shoplifting, but without breaking and entering. Or forgery. So, part din siya sa criteria for conduct disorder. Other serious violations, they often stays out at night despite parental prohibitions beginning before age 13 years old. So usually yung mga parents very stressed na kasi they go out and usually they don't actually ask permission. So or if kahit na bawal, gagawin pa rin, okay? They also has run away from home overnight at least twice while living in parental surrogate, okay? So lumabas talaga sila sa bahay. So they can actually
go out of the house with a long period of time, okay? Returning for a lengthy period, okay? So, after month, babalik, kumbaga, yung stress mo, grabe yung stress mo sa kanila. Okay, it's often true from school, okay? So, usually, nagka-cutting class. So, before age 13, okay, this happens. So, other than that, there are also criterias na merong disturbance in behavior, causes clinically significant impairment sa academe, occupation. So, if the child is actually 18 years old or older, and it doesn't meet the criteria for antisocial personality disorder, so it's part of conduct disorder. But please watch my video about antisocial personality disorder.
Okay, so those are actually the criteria for conduct disorder. So if you actually have encountered, for teachers, for example, if you have encountered students who are actually truant, okay, so they skip classes, they bully other children, they go against the rules of the school, and they're often being called at the guidance in order to explain some mischievous behaviors. Okay, so these are actually just one of the factors in considering conduct disorder. But there are also a lot of criteria for conduct disorder that I actually have discussed. Okay, so I will again mention it. So there are times that children can actually, like for example, um, get things that are not their things, okay, from their classmates and without permission. And they can also do things like um, going inside the house of other people without the permission, okay, so they're trespassing. Others are actually due to their peer group influence, or influenced to do things, to hurt other people, to ruin some properties and other important stuffs that are not actually their stuff. So it's one of the factors that we consider for conduct disorder. And these are actually conduct disorder is one of the problems of problems of teachers, not only teachers but also the parents. Okay, there are parents that can be okay, one of the factors if there is abuse at home, or if there are actually bad role modeling with regards to the children. But there are actually parents who are good role models. However, children still experience conduct disorder. Okay, so they are often brought to the police station and being blotted for some behaviors. And these children also suffer from staying in a place with other children who can actually influence them in a negative way. Okay, so they stay, for example, no, they stay in a specific area, in a police station, or in a DSWD, because they are actually minors. Okay, they do bad things, but they cannot be imprisoned. Okay, because they are minors. So usually what others do is they stay at the DSWD or specific area or house, or any rooms that they can stay for a night or a few days before they are given back to their families. But it depends on the situation of what kind of behaviors or what kind of crimes they have done. Okay, so yes, they can actually do crimes at an early age. Okay, that's why it's called conduct disorder, because okay, misconduct. Okay, there are a lot of behaviors that are against the law. So I have actually discussed antisocial personality disorder. So please watch antisocial personality disorder, because this is actually the personality disorder that can be developed from conduct disorder if these children will not be treated, and will develop sooner or later antisocial personality disorder, which is most likely if they go astray. Okay, these children who have conduct disorder. So please take note of those criteria for conduct disorder. Okay.
So take note, there is repetitive and persistent pattern of severe aggression. Okay, it may co-occur with problems like ADHD or attention deficit hyperactivity disorder, okay, academic deficiencies, and poor peer relations because they want to start the fight. Okay, the family child rearing, okay, may contribute to problems. Okay, parents feel that children are out of control and feel helpless to do anything about it. So remember that they lack remorse or guilt. They actually disregard or is unconcerned actually of the feelings of others, and does not express feelings or show emotions to others. So take note of those. Okay, if children have childhood onset, at least one symptom before age 10, usually it is more likely with the boys and show more aggressive symptoms. Account for disproportionate amount of illegal activity, and it will persist and can be antisocial personality behavior over time. If it is adolescent onset, usually it's likely to be girls and does not show the severity or psychopathology characterizing the early onset. Are less likely to commit violent offenses, unlike those who have childhood onset. Okay, so there are most children with conduct disorder actually have normal intelligence. So if there are verbal deficits are present in early development, it may interfere with self-control and emotional regulation, receptive listening, and expressive speech. So deficits in executive functioning actually also means other disorders. Okay, there are actually school and learning problems. So there is underachievement, grade retention, special education replacement, and relationship between conduct problems and underachievement is firmly established by adolescents. Okay, there is family problems. Okay, general family disturbance, specific disturbances in parenting, practices, and family functioning, high levels of conflict, and lack of family cohesion and emotional support. So, family is very important, no? Again, I mentioned they become bullies, some become bullies, and young children with conduct problems display poor social skills, verbal and physical aggression towards peers is noted. Okay, so take note of that. Um, then, children is rejected in primary grades are 5 times more likely to display conduct problems as teens. So, other than that, peer problems such as they often form friendships with other antisocial peers. So, they have negative peer group influence. So, predictive of conduct disorder. Low self-esteem is not primary cause of conduct disorder. Instead, problems are related to inflated, unstable, and or tentative view of self. So youths with conduct problems may experience high self-esteem.
So, for the treatment of conduct disorder, we actually, advise to you to seek professional help because management will be depend on the symptoms and the behavior of children. And usually, if there is no indication for treatment, therapy is actually highly, advised to be started to the children and with help of their families. Okay, so I hope you have learned from this channel, and so please comment, comment, share, and subscribe to my YouTube channel, DocVon. Thank you for your valuable time. God bless.